Hello, everybody. Welcome to another episode of Out of Order. My name is Anthony Buono.
My name is Ben Mayer.
And today we have our deep dive of the week.
Yes.
We are going deep into the history of Medicare, what it is, all the different parts, and then what the future of it could possibly look like going forward. So I want to take us back to the very beginning of this whole experiment with national health care. So with the rise of the progressive age in the end of the 19th century, Teddy Roosevelt's coming into power, and Teddy Roosevelt is a big believer in the government doing things. Teddy Roosevelt wants the government to build highways. Teddy Roosevelt wants the government to have a strong military. Teddy Roosevelt wanted the government to have a national healthcare system all the way back then. And he didn't really know how to do it. He didn't really have policy advisors on making out large policy proposals, but he talked about how it was important to have a healthy nation. And he wanted to do something like this. And so the rhetoric was starting to become introduced in the American psyche. And throughout the 1910s, state governments were seeing bills proposed in their state legislatures to create statewide healthcare programs. And these didn't end up going anywhere. None of them really passed, but it was showing the swell of support of something like it. And so when FDR comes into power in 1932, this is the age of the New Deal. It's an age when government isn't afraid to experiment. It isn't afraid to be the laboratory of democracy. It's okay trying things, throwing things at the wall, see what sticks. Doing the Agricultural Adjustment Administration, the National Recovery Administration, the Wagner Act, all these things, trying to make an economy work. And so when the Social Security bill comes to the floor in 1935, a lot of people are trying to throw in not just retirement insurance, not just unemployment insurance, but a lot of people were trying to throw in health insurance in this bill. And so FDR wrestled with this for a long time, and he wrestled with it with Francis Perkins, his labor secretary. He's trying to figure out if he should put it in, but physicians across the country actually fought back against the implementation of a national health care insurance program at the time. And they saw it as a threat to their organizational, financial, and clinical autonomy. These doctors were scared of the federal government getting involved with the nation's healthcare programs.
That's funny.
FDR didn't want Social Security to be on the chopping block. He was scared it wasn't going to pass at all. So he rejected the inclusion of a large-scale healthcare program to make sure that Social Security was not going to lose any support. But he did include one line in it that was interesting. This one line authorized the study of a national healthcare insurance program. And so that, again, it's laying the groundwork. It's not there yet, but he's showing that the government wants to move in that direction. And for the first time, Harry Truman becomes the first president to formally support a national healthcare insurance program in 1945.
Okay.
During his push, conservatives and business interests started to use the phrase socialized medicine. This is the first time we hear that. If you're growing up in the 2000s and the 2010s, you've heard socialized medicine on every Republican ad forever talking about Obamacare. Glenn Beck on the Fox News network saying socialized medicine. They're going to socialize your medicine. It's been an attack all the way back since 1945. And so why did they do this? Well, they're trying to tie him to the Soviet Union.
Yeah.
They're trying to make him sound like a communist. And so that's why Harry Truman comes out. And he said, I'm going to paraphrase here, but he says, Harry Truman was such a badass. He says, every advancement working people have ever made in this country has been called socialism by those who didn't want to see it happen. Which is true. You know, Social Security, all of it was called socialism. And in 1951, Truman's administration proposed a 60 days of hospital insurance a year for the 7 million elderly retirees who received Social Security. So they're trying to weave a health insurance program into the Social Security framework. So, okay, if you get Social Security, you also are going to get this hospital insurance program, 60 days out of the year. 7 million elderly people affected. Now, liberals, by this point, had given up on a general health care insurance program. They realized it wasn't going to happen. They said, listen, we can't get it for everybody, but if we focus in on one interest group, the elderly, maybe we could get it then. And the thought process of the liberals at the time was, okay, let's focus on the elderly now. Maybe we'll focus on the children later, which they end up doing through the CHIP, the Child Health Insurance Program. Then we could focus it on the poor through Medicaid. That gets diluted, and we'll talk about that. But the liberals decide we need to change tactics. We're thinking too big. We got to go smaller, and we can chip away at this over the decades. So in 1962, I want to put things in perspective about how bad it was for the elderly at the time. In 1962, 47% of elderly families had incomes below the poverty line.
Wow.
Half of our elderly population was impoverished at this point.
That's crazy.
Before Medicare's enactment, only half of older Americans had any health insurance at all. Only half of the elderly population. So there are different ways about how people want to go about this. How do we fund it? Who runs it? All these questions have to be answered throughout the years of trying to build out this liberal proposal for an elderly health insurance program. So reformers wanted to expand the Social Security model of payroll taxes to health insurance coverage. The proposal for what came to be called Medicare was built on the Social Security model in its eligibility rules, financing, and administration. So liberals got what they wanted. They took the Social Security model and they put healthcare insurance right into it. And they were able to make that. That's why it was able to actually get started so soon and so fast and so smooth.
Okay.
Because they just took the existing framework of Social Security and said, oh, here's the Medicare stuff. Drop it on top of it.
Yeah, and just pad a little bit more funding on the outside.
That's exactly it. So now I want to talk about so that was the history of Medicare. Now I want to talk about how did they pass it? What was the political maneuvering and the different things that happened and got passed in the original Medicare law? So in 1965, the law included more than the original scope of only hospital insurance. So again, what was the Truman proposal in 51? 60 days hospital insurance. Is that what ends up getting passed in 65? No. It's actually way better. It didn't just have hospital insurance. It also added insurance for physicians' services to the bill. Okay? So this is what leads the difference between Medicare Part A and Medicare Part B. And you've probably heard this before if you've ever done any research into Medicare. If you're on Medicare now, you know what Medicare A and B mean. So Medicare Part A covers hospitalization costs and will be funded through the payroll tax. Medicare Part B is different. It covers physician and outpatient services. This financing comes from the combination of beneficiary premiums and general revenues. So that's like the overall most important aspect to understand about the 1965 Medicare law. Now there's another aspect to this because the Medicare law didn't just create Medicare, it also created Medicaid. But the creation of Medicaid was not altruistic because what is Medicaid? It gives health insurance to the poor. That sounds great. As a liberal, you'd want that. But then you ask, why wasn't it just covered through Medicare? Why wasn't Medicare elderly and for the impoverished? Well, it was actually done on purpose. Conservative Arkansas Democrat Wilbur Mills of the Chair of the Ways and Means Committee did not want to see Medicare passed originally.
Okay.
And in fact, he actually killed it back in 1964.
Okay.
Only when it was reintroduced in 1965 did he finally sign on to it. So he wanted to stop Medicare from ever becoming a general health insurance program. It was his expressed goal to stop the expansion of Medicare from ever covering anyone other than the elderly.
Okay.
That was his goal. So by including Medicaid in the bill, the poor could not be a potential target for the federal health insurance program because the poor were already covered by Medicaid. So unlike Medicare, Medicaid is not run by the federal government. It's administered and financed by both the state and the federal governments. So the Medicare debate thus ended with a surprising 3-layer cake of Medicare Part A, Medicare Part B, and then Medicaid. And the difference of throwing Medicaid to the side is that Medicaid isn't a universal program. Everyone in America gets Medicare Part A. Everyone in America gets Medicare Part B. But not everyone gets Medicaid. And that means people look down on the people who get Medicaid. People aren't as incentivized to fund Medicaid because they're not going to end up getting it one day.
Yeah.
And because of that non-universality, it puts the poor people on the shopping block every time budget cuts need to come around.
Yeah. For states, that is.
For states, that is.
Yeah.
Now, I want to talk about a little bit of the Republican backlash because there was a lot. This is a couple of quotes. This comes from Ronald Reagan, actually, in 1961. behind Medicare will come other federal programs that will invade every area of freedom as we have known it in this country. Classic Reagan. Classic Reagan.
Yeah.
Classic Reagan. The Journal of American Medical Association in 1957 said that this would be the beginning of the end of private practice of medicine. Again, going into this social, I know, which is so...
Yeah. Always the extremes.
Always the extremes, dude.
Yeah.
It's also funny because all that's happening is the federal government picking up the bill and doing very, very minimal regulatory standards.
Yeah.
Right?
Yeah, of course.
It's not like we're dictating, okay, hospital office, you need to have this high of a ceiling. That's not what's going on.
No, not at all.
So while Medicare was great, it left a lot of gaps. So the 1965 Medicare law omitted coverage of crucial services, one of them being outpatient prescription drugs and long-term nursing home care. Medicare required significant beneficiary cost savings without any cap on how much enrollees could pay in a given year. So like there's no out-of-pocket cap. If you're running up a big bill, you're getting screwed over. There are donut holes here that are not being filled. And because of this, a new thing gets created where the market comes in. It's called Medigap.
Yep.
This is an employer-sponsored insurance program that fills in these holes. And so what's going on here is Congress is not willing to expand the benefits of Medicare. That's not what's happening. They made Medicare Part A, they made Part B, and instead of filling the donut holes through an increase of benefits and maybe an increase of premiums, they're leaning on the private sector to cover the gaps.
Yeah. Which is also, I mean, Medicare is for older people, so you're implying that the older people need to continue to work to get that coverage.
Exactly. And so then we go into the next phase of Medicare. And this is the privatization phase. This is the shift away from government operation and government control and putting it back into the hands of the private sector. So when did this happen? The Balanced Budget Act of 1997 fundamentally changed Medicare forever. This created Part C, otherwise known as Medicare Advantage. This enables beneficiaries to enroll in insurance plans that are private, but they're sponsored by companies that are contracted from the federal government.
Okay.
So they're private companies, but the government runs through them, checks them, says, okay, we approve.
Okay.
But they're still private entities, which means they're making profits, which means that they're operating their home procedure here. And currently, 47% of Medicare beneficiaries are on Medicare Advantage.
Wow.
Almost half are on Medicare Advantage nowadays.
Yeah. Well, because I think Medicare Advantage also has, it fills some coverage gaps.
Yes.
Yeah.
It fills some coverage gaps, but there's gives and takes with Medicare Advantage. Your networks are a lot smaller with Medicare Advantage. There are definitely gives and takes to it. Republicans and Democrats now find themselves in a constant battle here, whether to make Medicare a voucher system or a direct premium-based one. So a lot of Republicans, since this point, have said, screw Medicare Part A and B, make it all Medicare Advantage, just eliminate it.
Sure.
And so now I want to do a little bit of a diatribe here, and I want to go back a couple weeks or a couple months. We did a story about Tim Sheehy from Montana. And Tim Sheehy is running for Senate against incumbent Democrat John Tester. And Tim Sheehy said something once. He said he wants to bring health insurance back to the private sector. I think this is what he meant. I think I understand it. He doesn't want to write Medicare off entirely, because that would be ridiculous. He wants to make it all Medicare Advantage.
Why would it be ridiculous to write Medicare off entirely?
Why would it be ridiculous to, well, I mean, half of America is on Medicare A and B, right? So what he's saying is, I think what he's talking about is he wants to take Medicare away from a premium-based system into a voucher-based system, where people get, the option to pick government checked options.
I see.
Instead of simply buying the government premium.
Okay. And still probably... so basically the difference is just to have government regulation.
Government regulation as opposed to government run.
Yeah.
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 Yes.
Okay.
That's what I think the Republican model... That's the Republican model for the future of Medicare. And they make that explicitly clear in 2009. Republicans voted to completely eliminate Medicare's Part A and B in the Congress.
So the only real I mean, I guess the regulation could be good, but the other real benefit is just that you're automatically enrolled. Like, you're not necessarily going to get it cheaper.
No, you're definitely not going to necessarily get it cheaper. That's for sure.
Right. So,
well, I mean, what is the benefit? The benefit is that, listen, the benefit is that they don't agree with government-run programs.
No. I mean, but for an enrollee.
For an enrollee.
Medicare at that point.
I don't know.
There's almost nothing.
It's
just a private program that's regulated.
Yes, that's basically what it will come down to by the end.
Yeah.
So Medicare Advantage definitely gives people more choices. I want to put the choices in quotes because you need health insurance.
Mm-hmm.
You know, it's not really like you have choices. It's like, what are
but they can cover and I mean, you have choices with health insurance.
No, yeah, you have choices with health insurance, but my issue with the whole health insurance thing is you really, I can choose not to have my leg covered, but then when my leg breaks, I'm really pissed about it.
Yeah, but there are more fringe things than that.
Yeah, that's fair.
Yeah.
But the largest downside, the biggest downside that I see with Medicare Advantage as opposed to Medicare's Part A and B is the amount of money that goes directly to providing health care from both programs. This is, I think, the big crux of the problem. 86% of all money that goes to Medicare Advantage plans through premiums goes into providing care. On the other end, 99 to 98% of all money that goes to Medicare Part A and B goes to providing care.
Yeah.
So what this is showing is Medicare Part A and B are hyper efficient as compared to Medicare Part C.
Yeah.
Because there's no profit.
Yeah, of course.
There's no profit going on here.
Yeah, and the other problem is political because, I mean, as you've just laid out, because there is a Medicare Advantage, there's always the idea that we can just slip more into that framework, into that lane.
Yes. And so this disparity actually used to be way worse. It didn't used to be 86% of the money going to care. It actually used to be way worse.
Really?
But the Affordable Care Act passed by Obama forced all of these companies to only allocate maximum 15% of their premiums to overhead.
Wow.
So then they capped the amount of money that they could take for profit as 15%.
Yeah.
And so now it's 86%.
It's funny how they've been so effective as to get it only
right on the line, right?
Yeah.
Exactly, right on the fucking line.
Yeah.
And so again, I want to emphasize, in 2009, Republicans in the House voted to eliminate traditional Medicare plans Part A and B. They voted to totally gut it, which I didn't even know. Democrats don't do a good enough job making that clear. Republicans literally voted to eliminate Medicare as we know it, period.
Too distant in the past.
Maybe too wonky. I don't know.
Yeah.
But I hope that
too hard to explain.
Yeah, right?
Yeah.
I mean, look at us. We're making a whole video about it.
Yeah,
so
exactly.
That makes a lot of sense. But this isn't the last change that happened to Medicare. There was a big change in 2003. The Medicare Modernization Act was passed in 2003 under the George Bush administration. During the 2000 election, Al Gore and George Bush both ran on a program on expanding Medicare to cover prescription drugs costs. Now, what was the plan here? Well, during the Clinton administration, the government racked up a surplus of money, and both people, Gore and Bush, wanted to advertised using this surplus of money to pay for a pharmaceutical addition to Medicare coverage to cover drug costs. The philosophy was different. Gore wanted it to be a premium-based system, not privatized, not through Medicare Advantage, through Medicare B, not through any private health insurance systems, all done through Medicare A, B systems. Now, Bush did it differently. He passes the Medicare Modernization Act of 2003. This creates Medicare Part D. And these benefits are provided through private plans that are approved by the federal government, very similar to Medicare Advantage. Okay? But the difference is, if you get Medicare Advantage, you don't get Medicare Advantage and Medicare Part D.
So you have to get Medicare Advantage, then pay an extra premium for Part D.
No. If you get Medicare Advantage, you get prescription drug costs covered through Medicare Advantage. If you have Medicare Part A and B, you now have to buy into D.
Okay.
So Medicare Advantage, if you have Part C, you don't do A, B, D, none of that. It's irrelevant to you.
Okay.
But if you have A and B, you have to also buy into D.
I see.
Okay? Now, I didn't get there's a lot of political backlash to Medicare Part D. There's the fact that it's privatized makes everyone on the left and liberals uncomfortable. They don't like that. They view it as a distortion of what Medicare was supposed to be, and I happen to agree. But it was definitely better than nothing at the time, and I will live by that at least.
Yeah.
So that's how Medicare operates now. That we kind of ran through the history of Medicare, where it operates now, and I kind of want to think about the future of it because it's important. We talked about earlier on in the show this week that the Biden administration made shoring up the Medicare Hospital Trust Fund a top priority and will raise taxes on the wealthiest among us to make that program whole, which is a fantastic thing to run on. I love to see fiscal responsibility and to say, listen, no, we have too much money in the economy right now. Government's got to take a portion of that and make sure all of our bills are paid.
Yes.
Love that. Bernie Sanders has been pushing for a Medicare for All system for a very long time, decades even. But has recently shifted to expanding Medicare Part A and B to cover hearing aids, glasses, and dental care, which is a good start.
I'm still with him on Medicare for All, but maybe he's finally realized what's politically possible.
Right. And it was like after Biden won, he was like, okay, I got you. I understand. I'll push you. So Biden on paper is in favor of lowering the Medicare age to 55.
Okay.
On paper, his policy website will say that. It's not in his budget.
Yeah.
Right. So it's not really putting his money where his mouth is. But Bernie Sanders tried to include this expansion of Medicare in the Build Back Better Act.
Okay.
Back in 2021-22.
Maybe the issue right now is you have to win the fiscal responsibility battle first and then try to push to expand it.
Yeah, that's one of the issues. But now what I love to see is this is a mainstay of the Democratic Party platform. I mean, Nancy Pelosi, as establishment Dem as you get, is for expanding Medicare Part A and B to cover hearing aids, glasses, and dental care. So that's really great. It's become a full integration of the Democratic Party. And even Hillary Clinton back in 2016 ran on lowering the eligibility age of Medicare recipients down to 50. Even she was in support of that.
Yeah.
So the Democratic Party is getting more and more open to the idea of expanding Medicare, and I do think it is inevitable.
Yeah, they're kind of following up on the original plan from the 50s and 60s, right?
Exactly,
they're trying to chip away.
That's exactly what
but
it
is. I do hope there is such a difference between ensuring these little pieces of the population through the government and automatically ensuring everyone, as far as how it transforms the market, the healthcare market, right?
Really good point.
Having the monopsony buying power is so important to drive down our healthcare costs, which are ridiculously high. Not to mention it makes the administration costs, which are also ridiculously high here, lower because it's easier for every doctor to deal with the one insurer.
Yeah, it's like for every doctor's office, there's like a bunch of billing agents in the back.
Yes.
That doesn't need to be necessary. That doesn't need to happen.
Exactly.
So Medicare for All, I'm a huge supporter of Medicare for All. I agree with Bernie Sanders' proposal of a 4-year phase-in. The way that he does it is it takes 10 years off every year until you get down to 0.
Yeah, I like that.
That's the way to do it, man.
Totally.
And also, since Medicare was such a clean rollout back in 65, such a clean rollout, we could do it again.
Yes.
It's not impossible. Good things are not impossibly difficult to do. And I'm really glad that Medicare is around, and it's going to be around for the future if we elect the right people who want to keep it alive.
Yes.
If we elect people who want to destroy it, it will go away.
Yeah. I do want to bring up also the recent efforts that have been made by the Biden administration to negotiate prices for drugs via Part D of Medicare, because this is something that basically the government has just been getting ripped off like crazy.
Not just the government. You and me are getting ripped off.
Yes.
We are getting ripped off.
Exactly.
The government isn't some nebulous thing. It's us.
Yes. And it's because for some reason, the Medicare legislation didn't allow them to negotiate drug prices that they were buying from these pharmaceutical companies. So they've literally been like 10 times more expensive than they should be. And the Biden administration has continued to expand the list of drugs that it can negotiate prices for, which is a huge deal, makes a real difference. And then the only other thing I want to say is the healthcare discussion and conversation in political discourse has somewhat died down, or at least gotten quieter since Obamacare was passed, because even many liberals and people like Bernie Sanders, who do think that universal health care is the way to go, think that we've almost gone as far as is politically possible right now. So I just want to point out that if there is ever a chance to bring it up, and to push the envelope more. Realize that what we have now is still totally not good enough.
Broken.
It's okay, but it's not good enough, and we want to push it further.
Some may say it's out of order. Thank you for watching this episode of Out of Order.
Crazy that you made it to the end.
If you enjoyed the content, please subscribe on YouTube and check us out on Patreon.
Yep, link is in the description of our YouTube channel, and we're super poor, so we could use any support you can give.
Fantastic. Thanks, guys.